A tonsillectomy is a surgical procedure to remove the tonsils. In fact, anytime ectomy is used, it means the surgical removal of an anatomical structure. Tonsillectomies are one of the most common surgical procedures performed in the United States. Tonsillectomies are commonly performed for two main reasons: recurring infection of the tonsils or enlarged tonsils. Infection of the tonsils leads to inflammation and swelling, known as tonsillitis, which can be very painful. Symptoms can include fever, persistent sore throat, redness of the tonsil area, yellow discharge on the tonsils, and tenderness of the lymph nodes on both sides of the neck. Most often, tonsillitis is caused by viruses. Sometimes it is caused by bacteria, typically Streptococcus, which is commonly referred to as strep throat. Doctors can treat strep throat with antibiotics such as penicillin. Tonsillitis caused by a virus will not respond to antibiotics, so doctors will often treat the symptoms of the infection with over-the-counter pain relievers and home remedies. For those patients who have consistent, repeated bouts of tonsillitis, doctors may consider surgical removal of the tonsils as a treatment. This treatment is called a tonsillectomy. The traditional method of choice for tonsillectomy has been electrocautery. Electrocautery generates very high temperatures by applying high voltage energy directly to the tissue. This energy uses high heat to rupture cells in vaporized tissue. Further, this heat energy is transferred to surrounding tissues, which may cause significant damage, such as burning and charring. Tonsillectomies usually last about 30 minutes to an hour and are outpatient procedures, which usually means the patient can go home after surgery. However, if there are complications or surgery is performed on a young child, an overnight stay may be necessary. Tonsillectomies are often performed using electrocautery. Electrocautery kills and removes tonsil tissue by essentially burning it. This sometimes causes significant damage like burning and charring, which can lead to unpleasant post-operative conditions such as burning and charring of surgical site. There are different ways to perform a tonsillectomy. Electrocautery uses electrical energy to remove the tonsils. Coblation technology is an alternative to electrocautery and uses plasma energy to precisely remove soft tissue. This plasma field is contained at the tip of the coblation device and dissolves tissues molecule by molecule, resulting in the precise removal of the targeted tissue. The coblation process generates significantly lower temperatures on the contact tissue. This minimizes damage to the surrounding healthy tissue. Patients' recovery experiences are affected by a variety of factors such as their age, the technology used to perform the tonsillectomy, and how closely the patients follow their doctor's instruction. Depending on these factors, some patients may recover more rapidly. Some patients' recovery time may last 2 weeks. The most common post-surgery symptom is a sore throat. Pain in the neck, jaws, or ears may also occur for a short time. Bleeding from the surgical site should not happen. If such bleeding occurs, contact the doctor immediately. Your ENT specialist will provide you with the details for preoperative and postoperative care and answer any of your questions.